Funding for this edition of State of Affairs with Steve Adubato has been provided by the Fidelco Group, Horizon Blue Cross Blue Shield of New Jersey, Investors Bank, Gibbons PC, PSE&G, committed to providing safe, reliable energy now and in the future. The Port Authority of New York and New Jersey, moving the region through air, land, rail, and sea. New Jersey Sharing Network, the Healthcare Foundation of New Jersey, and by the Adler Aphasia Center, enriching the lives of people with aphasia, their families, and communities. Promotional support provided by the New Jersey Business and Industry Association and by AM 970 The Answer.
Hi, I'm Steve Adubato. We are coming to you remotely, but again, the content is just as compelling. We are honored to kick off this program with Mr. Brian Gragnolati, President and CEO of Atlantic Health System. Brian, good to see you, my friend.
Great to see you.
You know, as it relates to COVID-19, we're taping on the 16th of June. It'll be seen after that. You said in an article, I believe in ROI, you said, quote, "Life as we know it is going to have to change." Mm-hmm. In what ways?
You know, I've labeled this internally and as coexisting with COVID. The reality is, until a vaccine is developed and until we have a silver bullet antiviral, we are going to be living with COVID. And I expect that, quite frankly, to be at least a couple of years. So that means that we have to do things differently. And the example I like to use, which is a trite one, but I'm now liking the fact that I don't pump my own gas. I can take my wipe, hand it out on my credit card holding the wipe, get it back, and it's a different way of pumping gas. Think about that and extrapolate that to so many things you do, how you shop now, how you wear your mask, how, if you and I were in person, we probably wouldn't be shaking hands right now, and we'd be 6 feet apart. That's the difference.
Let me just close a couple of things. First of all, Atlantic Health System, one of the healthcare systems underwriting our programming. Brian, but it's interesting. You said a couple of years, and Brian Strom from Rutgers University said something similar to that, and I challenged him. I didn't challenge him, but I followed up in this way. I'm going to do the same thing with you.
Sure.
If there's so much focus on a vaccine, potentially by the end of 2020, early 2021. And many people believe that's it, we're good. And then you just said a couple of years, they don't jibe.
Sure. So if you think about it pretty simply, the government has taken dramatic steps to try to close the gap on how long it takes to come up with a vaccine. And they've thrown a lot of resources at multiple people who are thinking about this, multiple companies who are thinking about this. And my bet is that we're not going to just have one vaccine. We will actually have multiple vaccines that are going to be available. But once those vaccines are developed and tested, you have to get them produced, you have to get them distributed, and you have to get people inoculated. And there's a supply chain element to this. There's a human nature element to this. And I do believe that we're going to be coexisting with COVID for 2 years.
Let me ask you this, because as I said, we're taping in the later part of June, be seen later. This second wave issue. Mm-hmm. If that plays out, first of all, we don't know how significant that wave would be. How are hospital systems like yours, others, we've interviewed your colleagues, your counterparts at different hospitals and hospital systems as well. How do you believe that the hospital systems or hospitals will be prepared differently and better?
Sure. Here in particularly northern New Jersey, we literally are a hotspot in the nation. We've taken care of over 10,000 patients with COVID, and we have had in our hospitals about 4,000 of those patients.
Brian, do me a favor, clarify the hospitals within the system.
So we have 7 different hospitals. We have hospitals in Morristown. We have hospitals at Overlook, Chilton, Newton, Hackettstown. We reopened a hospital to take care of patients, ARI, and we also have a rehab hospital.
Okay.
Because of our geography, and remember, this virus came out of the city. It followed the transit lines. We were in the middle of this for a long period of time. And we had to, in a very short period of time, double, triple, and then quadruple our intensive care unit capacity. And we had to, more importantly, reconfigure our teams in order to provide that, because we had to have the human resources to be able to do that. And we had incredible learning through that whole process. And because of that, we're going to be able to stand that capacity up again in short order, but it'll be done in an orderly fashion. So that's one piece. The second piece is we've learned a lot about how to take care of patients with this virus. And the way we provide care has changed over time. And because of that, again, I think we've got a better command on this. While our testing is still a problem, we have gotten our arms around getting quicker testing, and that's going to help. But the key thing that we're still worried about right now is making sure that we're going to have an adequate amount of protective equipment for our team members, and we're working hard to make sure that that happens. But I would like to be in a position this fall where we have the ability to surge to 125% of what our peak was. But I get down on my knees every night and pray that that doesn't happen.
Brian, the other side of this, for your colleagues, frontline workers, describe for folks what they have faced and will continue to face?
So our team members on the front line are indeed our heroes. I had an opportunity to round just at the end of last week at Morristown Medical Center, which had just a number of COVID patients that were cared for. And I saw a clap out of a patient who had been with us 61 days. 61 days he had been with us. And our team members were in tears, and it was just such a joyous occasion. But make no mistake, they are our heroes, and it has been very, very hard work. And it's been hard for a couple of reasons. We're used to taking care of really sick patients, but this disease was not able to be compartmentalized.
What do you mean by that?
In other words, I was an EMT, and if you had a very difficult case, you knew that you did your very best and things would go on. You can't get away from COVID. You're worried about taking it home. You're worried about going to the grocery store. It's on television all the time. You can't compartmentalize it. The second thing is, in order to be effective, you have to isolate and socially distance in ways that in healthcare, we're just not used to. Because, part of, again, if you're a clinician, you have the ability to hug, or you have the ability to high five, and you have the ability to cry together or laugh together. You're in a mask, you're in a face shield, you're gloved up. It's very different. And probably the most difficult thing was the inability for patients to see their loved ones directly during this process because of the limits we had to put on visitors. And oftentimes our team members were holding the patient's hand and holding a cell phone during those difficult conversations, particularly those patients that had to be intubated and those patients that were passed away. And it put our team members in an unbelievable position. And I am so proud of what they've done.
You know, we got a minute left. As you listen to Brian Gragnolati, I'm just trying to imagine the reality of what he's talking about, and I actually can't. Um, but I digress. I want to follow up on this in the minute we have left. The question of telehealth, more important than ever before, correct?
Absolutely.
And the future of it is?
The future of it is depending on how the government responds and how payers respond. We have transformed care as it relates to telehealth and put it in a more consumer-friendly manner and put it in people's homes where they're safe. We went from doing about 10 telehealth visits a day. Within 2 weeks in our practices, it went to 3,000 telehealth visits a day. Now, the government has enabled that because they've allowed us to be paid for that. We need to make sure that those rules that were put in place during this emergency are codified and put into law. And we've got to make sure that the payers, the insurance companies, continue to adopt paying for those practices. And that's critically important because it is here to stay. But if it doesn't get paid for, it's not going to work.
Brian Gragnolati is president and CEO of Atlantic Health System. Brian, I want to thank you so much for joining us. I wish you and your team all the best.
Thank you.
We'll be right back right after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
Welcome back. We are pleased to be joined by Marilou Halvorsen, who's president of the New Jersey Restaurant and Hospitality Association. Marilou, good to talk to you.
Thank you so much for having me.
We're taping on the 16th of June. The greatest impact on the restaurant industry, we'll talk about hospitality in a minute, has been?
Everything.
Everything.
It's obviously financial, it's job loss. We are the economic engine. We're the state's largest private sector employer, employing about 350,000 jobs, not counting hotels. So those are a lot of our New Jersey residents that once we can open up the restaurants, they'll go back to work.
And again, because we're taping on the 16th, decisions will be made, changes here and there, outside, inside. We don't know as we speak when people can eat inside a restaurant. But for those who say, you know what, it's safer outside, let's just do that. That sounds great on paper. What's the problem with the execution of that for restaurants to survive and thrive?
Well, it's not really easier, and it's not just necessarily safer, right? So other than healthcare, restaurants do sanitation every day, all day. It's already ingrained in our normal practices. So when you come to a restaurant, you know that everything has been cleaned and sanitized.
But hold on one second. But it is safer. Every public health expert that we've heard said it's safer to be outside than inside. So there's something to be said about that.
Well, it depends what the distancing is. It depends what the sanitation protocols of where you're sitting. So if you're sitting down and you're, proper social distancing and that table's been cleaned and sanitized and you have disposable menus and your condiments have been clean and it's a completely sanitized environment, then that is not as safe as when you have a bunch of people sitting outside at a picnic table crammed together that, are not from the same family. So it's easy to say that, but that does not necessarily mean it's true.
What I'm curious about, Marilou, is there's so many, I was saying this before we got on the air, we happen to live in Montclair, New Jersey. There are so many restaurants that we count on beyond the home cooking that goes on, which can be tough with working moms and dads, remote or not. They're the lifeblood for us to be able to eat dinner when we do, et cetera, et cetera.
Yeah.
The takeout piece of this is big, but you put it all together. Who winds up surviving and who doesn't in this? Are there certain keys to that?
And that is a great point because, as I've said often, right now we are how many months into this? And
as we do this, 3 going on 3.5.
Okay. So we're about 3.5 months in. Approximately about 20% has been calculated by the National Restaurant Association that small independent restaurants will not come back. And those are your community restaurants your neighborhood restaurant that you like to go to. It's not the large chains. It's the ones that don't have the access to cash. One of the best things about the culinary atmosphere in New Jersey is the small, ethnically diverse restaurants. I mean, you can go anywhere in New Jersey and get any kind of food you want.
Right.
And that's at risk because those people don't have access to capital.
And so let me ask you, the government's making these policies, okay? You've been advocating on behalf of the Restaurant Association, hospitality piece of it. I'm curious, define hospitality.
Well, hospitality is anywhere where you're a guest and someone welcomes you into their business. So it's pretty broad. But in our sense, for our association, it's restaurants of all shapes, sizes, it's hotels. And we also have a lot of amusement parks that are members of our association. So it's pretty broad. It's, really anything under the quote unquote hospitality, but primarily we're restaurants, but we do have a lot of hotel members and some amusement parks.
Go back to the question of employment. This is so interesting because there's an economic impact of this. There are, how many employees are we talking about again?
So just for restaurants, it's about 350,000. When you add hotels, it's about another 150,000. So that's a lot of people. That's 500,000 people in the industry. That's why we are the state's largest private sector employer.
But the other part of it that's complicating and complicated is that if someone went on unemployment early on because a restaurant wasn't open and they couldn't employ them, couldn't pay them, is it tough for some of these restaurants because the unemployment benefits were expanded, they were extended, that for some, it doesn't make sense for some workers to go back? You see what I'm saying? The economic incentive.
Yeah, and obviously that was needed because we're in unprecedented times and we don't know how long that this was going to last. But as we see restaurants start to reopen, and we do know that the extra federal unemployment is going to be coming to an end, I believe, unless they extend it. But it has been an issue. It certainly has, because you have a couple things. It's not so cut and dry. You have childcare issues.
That's
so
right.
A lot of moms and dads who want to come back, not just to the restaurant and hotel industry, but to a lot of other industries, are struggling with what to do with their children. And of course the unemployment. So, you may be more comfortable staying at home. But I have been talking to my members, and since they've closed, they've kept in contact with their employees, and they're really pleased that a lot of them are anxious to come back.
Yeah, well, we'll monitor the situation. Again, we're taping on the 16th. On the 15th of June, a decision was made that opened up outside. We'll see what happens on the inside, what the capacity is, when that happens, how it happens. But I want to thank Marilou Halvorsen, who's president of the New Jersey Restaurant and Hospital Association. Marilou, all the best. Thanks so much.
Oh, I appreciate it. Thank you.
We'll be right back after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
We are now joined by Dr. Nancy Cantor, Chancellor of Rutgers University-Newark. And Dr. Cantor, good to talk with you.
Wonderful to talk with you, Steve.
And so we've talked to so many people in the higher ed community about the changing nature of higher education, online, in person, protecting students, faculty. If we can have time to get to that, we will. But with you, it seems to me your expertise, your focus, your commitment to racial and social justice is so strong. We're doing a series called Confronting Racism. In your view, as a social psychologist as well, what does it mean to, quote, confront racism?
So I think what it means to confront racism is to really think about the decades, if not centuries, of the architecture of segregation that has so eroded opportunity for people of color, Black, brown people, undocumented, all of our groups who have really brought their talent to our communities, and yet we have not given them opportunity. And when you think about opportunity, as an educator, I think about educational opportunity. Let's think about economic opportunity. It's jobs, it's housing. If we go back and think about the effects of redlining and housing policies and bank credit loans, we don't have intergenerational wealth happening in our communities. Look at the perseverance and the amazing strength of the residents of Newark over decades, over generations, over centuries. You've got a 350 plus year city with talent waiting to have opportunity. And, we really don't take a racial equity lens unless we're forced to.
Because?
Why? Because we're scared? Because it's a zero-sum game? Or because we have learned over those centuries not to value Black and brown bodies, and not to value those families, and not to think that they have the talent to make up our future. But we have a reckoning. We have a reckoning in social justice. We have a reckoning from a business perspective. Who's the talent pool of the future? If you think about the exploding, wonderful diversity of our country, that's the talent pool of the future. And if they are behind walls that artificially restrain the cultivation of their talent, their ability to have wealth and security and safety in their community, the ability to get health care, the ability not to be taken down by a pandemic, we have a responsibility, we have a reckoning. No question about it.
Dr.
It's been long in the making, of course, right?
But Nancy, we've known each other for a while, and you have been out front from day one. The question that keeps playing in my mind is, given what we all saw, the murder of George Floyd, what does this window represent for us to actually do what? A, and B, who's going to get left behind because they just don't get it or don't want to get it?
So I think the real question is, are we going to use this as a moment to change our investment strategy?
What do you mean investment strategy?
To change who we invest in and how we give opportunity. It's all about opportunity. You give Black and brown families opportunity, they will grab it. You give them loans, you give them housing stability, jobs. We invest in women and minority-owned entrepreneurs in the city of Newark. It takes off. We invest in amazing students who we have to invest in because the world didn't invest in them financially, or when they went to under-resourced schools. We invest in them, and their voice, their talent, their ability to make an equitable society and a flourishing community just comes through. I mean, it's amazing. People think it's rocket. They think, oh, this is going to be so complicated. It's actually not very complicated. For example, in higher education, we have to stop having these narrow views of who deserves to be in universities. We have to look for talent capaciously. We have to be out there from K through 20, making the pathway work. We have to put our money where our mouth is. I just really think this is a moment, but we've had moments before. So let's not.
A moment like this, Dr. Cantor, sorry for interrupting. Have we ever had a moment like this?
Have we ever had a moment like this? We've had centuries and decades.
I mean, an opportunity like this is what I mean.
An opportunity.
An opportunity to really do something. I don't mean just with lip service or photo ops, I'm talking about real change.
So I think this is a moment of real opportunity. I agree with you on that. And the reason I think that is my experience in Newark, New Jersey. We have a city where all the big anchors, from the Prudentials of the world to NJPAC to Rutgers Newark and NJIT and all the institutions, have come together to make a commitment. Look at Audible, look at their commitments here. And I'm not pointing to just individual anchors. It's really cross-sector. And what is really important is that those anchors are collaborating with the Newark Community Development Networks that's been here since the rebellion. Those
of 1967.
Of 1967. those neighborhood organizations are collaborating with large institutions, collaborating with resident groups, forming coalitions around public safety, community policing, forming coalitions around the Newark City of Learning Collaborative,
Right.
thinking about how we really invest in the people of Newark.
I'm Steve Adubato. That is Dr. Nancy Cantor. Boy, is she worth listening to. And we'll make sure you check us out next time. Take care.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Fidelco Group, Horizon Blue Cross Blue Shield of New Jersey, Investors Bank, Gibbons PC, PSC&G, the Port Authority of New York and New Jersey, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, and by the Adler Aphasia Center. Promotional support provided by the New Jersey Business and Industry Association and by AM 970 The Answer.
Hi, I'm Eric. You might see me as an ordinary person, but I've been living with a brain injury for nearly 2 years. One of my struggles is short-term memory loss. At Opportunity Project, I'm given hope and support, and I've gained my confidence back through the job placement program. Despite my challenges, I have a reason to keep improving. Today, even though life has changed me, I believe that anything is possible.
If you have a brain injury, you don't have to face your road to recovery alone.